Chris, you said almost everybody snores. Do they?
It's very, very common. Sometimes it's an indicator of something more serious, sleep apnea. It kind of depends on what level the snoring originates from. You know, in East Tennessee in particular, with a lot of allergy, we have a lot of stuffy noses, people with structural problems in their nose, crooked noses and broken noses, and that can be a source of snoring. That is a different part of the airway than what these CPAP machines are designed to treat, the sleep apnea that we see, which is occurring behind the tongue, much lower down here. So sometimes it's a weight-driven thing. Sometimes it's a structural problem. People are just built very, very small back there, and they'll get a family history of snores if it's a structural problem generally.
Are there decibels of snoring? Are there degrees where some people it's loud enough to wake up the neighbors?
Correct, yes, that's right. And sometimes that's a good indicator of a problem, not always. We have some very sort of championship snorers who just snore. We don't think that is a problem health-wise. It's annoying maybe to other people in the household. And kids are sort of the opposite of that. Sometimes children, snoring is a very poor indicator of sleep apnea for them.
So if you were to take 1,000 people that snored significantly, they were on the upper half of the bad, significant snorers, what would be the health of those people? Would they have more heart disease? Would they have more heart attacks? Would they have more problems with diabetes, with obesity, with the problems of sleep deprivation?
Probably all of those. It depends. I mean, you're mixing in patients who might have some sleep apnea. We know that sleep apnea links to all of those conditions.
So if somebody's bedmate says, "You snore, and you're keeping me awake," is that the time where somebody goes to seek help?
Usually it's the first stage, and then the second report that they'll give you is not only do you snore, but you might make a funny noise. You might snort or gasp or choke, or sometimes people wheeze, all kinds of different things. That then starts to put checks in the column for something a little bit more serious like sleep apnea.
So when I'm talking with the patient, I ask them, when I look at the back of the throat, I try and determine whether or not I think the patient snores. And if they do, I ask them how bad they snore. And then usually somebody's in the room. I say, "Do you ever have sleep apnea?" And then I will mimic snoring and give a long pause. Is that what we look for?
That's right. That's exactly right.
And then the gasp is when you wake up with a jerk or with a wheeze?
Exactly right. And sometimes it's just the jerk part that alerts the bed partner that there's something going on over there. The bed will shake and they'll look over and sort of...
You all right?
Exactly right, yeah. So it's that pause, and sometimes bed partners are so tuned into this, they're on guard duty almost at night, because those pauses can be quite long. They can last minutes sometimes, and you get long enough to get worried.
So if somebody has obstructive sleep apnea, I mean stop breathing during sleep, how dangerous does it get? At what point? When you said it lasts longer than 60 seconds, that would scare me to death.
That's right.
If I knew I wasn't breathing for that period of time. What's the normal apnea period?
About 10 seconds.
So 10 seconds is, what happens to the body during that 10 seconds that creates danger?
Well, thankfully, we're built with a sort of what's called the fight or flight system.
Yeah.
And that engages when the airflow into the body stops. You can tell something's not right, and the body responds to that with an adrenaline surge. That's the inward process that leads to that outward manifestation of that choke or gasp or jump or jerk and all that.
And meanwhile, the adrenaline is raising the blood pressure, speeding up the heart, and causing some other health issues.
Yeah, changes in oxygen level are one of the main things that we look for, and that links tightly to not only heart problems, blood sugar problems, but also things like gout, trips to the bathroom. We're seeing more and more referrals in for memory problems, headache.
Wow.
Yeah,
Wow.
So lots of different things are affected.
So as we're getting older, we're seeing more and more people with memory problems, and you said gout could be a problem with that, and other health issues. So what I'm wanting to say is, pay attention if somebody is snoring. That it's not just simply snoring that you say, oh, granddaddy snores, or oh, Joe snores. You know, it's a real health problem that needs to be looked at.
Yeah.